Welcome to Medicine Handy Point. Today, our topic of discussion is to take history from a patient presenting with hemoptysis. So, start. So, the first, we will discuss that what are the causes of hemoptysis. It could be respiratory, cardiac, or miscellaneous cases. So, in respiratory, we will look at infection first. So, the first thing we come onto our mind is pneumonia, tuberculosis, and lung abscess, bronchiectasis, and aspergillosis. These are the five top infection causes for the hemoptysis. So, then the next thing which comes to our mind is neoplastic, like bronchogenic carcinoma, secondary to the lungs, very common. The secondary to lungs are very common conditions, and Kaposi sarcoma, which occur in HIV patient. Then will the vascular causes which can cause hemoptysis. They include pulmonary embolism, Wagner granulomatosis, Ghost-Pasteur syndrome, and hereditary hemorrhagic telangiectasia. In cardiac condition, mitral stenosis can cause hemoptysis. Pulmonary edema can cause hemoptysis. Miscellaneous causes, any bleeding disorder can cause hemoptysis. Anticoagulant used for any medical condition can cause hemoptysis, and thoracic endometriosis, which is called catamenial endometriosis. It can also cause hemoptysis. Now, we will start the history by asking about the onset and duration of hemoptysis. Then we'll ask about characteristic of the hemoptysis, which is very important. So we'll ask for the color of the blood, whether it's a fresh blood. Then if the color of the blood is a pink and a small amount, it is usually because of the mitral stenosis and pulmonary edema. Then we will ask about the amount of blood in terms of teaspoon and cups per 24 hour. Either we will ask the patient to quantify the amount of hemoptysis in terms of teaspoons, or in terms of cups per 24 hour. That will give us the estimate of the blood loss in 24 hour, because the more blood loss, the worse for prognosis. Then we will ask about associated symptoms with the hemoptysis, like cough and sputum. Sudden answer of productive cough could be hemoptysis. With hemoptysis will suggest respiratory tract infection, while blood streak sputum we may suggest chronic bronchitis, while productive chronic cough with streak of blood in it could be bronchiectasis. Then we'll ask about dyspnea. Dyspnea could be because of the respiratory condition or cardiac condition. Respiratory condition which can cause hemoptysis with dyspnea, they include pulmonary embolism, while cardiac condition which causes hemoptysis with dyspnea, it includes pulmonary edema and mitral stenosis. Then we'll ask about pleuritic chest pain. If the patient is having pleuritic chest pain, it could be pulmonary embolism or pneumonia. If the patient is having fever, rigor, night sweat, then it could be fever with rigor actually suggests lung abscesses, while night sweat suggests TB. Anorexia and weight loss suggests TB or malignancy in a context of hemoptysis. Hemoptysis with hoarseness and dysphagia could be bronchogenic carcinoma, pressing upon recurrent laryngeal nerve, or pressing upon the esophagus, or dilated left atrium compressing upon the left recurrent laryngeal nerve. It can also causes hoarseness and dysphagia along with hemoptysis. Then we'll discuss uh, uh, then we will discuss whether the patient is having epistaxis along with the epistaxis. So that will suggest to us that the patient is having Wagner granulomatosis or hereditary hemorrhagic telangiectasia. Hematuria uh, occurs in Ghost-Pasteur syndrome, because hematuria and hemoptysis suggest Ghost-Pasteur syndrome. Leg swelling, it will suggest DVT, leading to pulmonary embolism and hemoptysis. If hemoptysis is cyclical, means occur every month in days of menstruation, then it is called catamenial endometriosis, means the endometriosis has involved the lung parenchyma. If the patient is having nausea, epigastric pain, and melena, then maybe the hemoptysis is wrongly taken for hematemesis. Then in the past history will also period chest infection will point toward the bronchiectasis, childhood rheumatic fever will point toward mitral stenosis causing hemoptysis, malignancy will ask about malignancy in previously, or malignancy can be lung malignancy or secondary malignancy leading to hemoptysis, or sometimes any malignancy can be procoagulant status and causes hemoptysis. Procoagulant status leading to embolisms and pulmonary embolism and hemoptysis. We'll also about CLD, coagulopathy can cause hemoptysis, and sometimes if the patient is complaining of hemoptysis and patient's CLD as well, maybe it's not hemoptysis but hematemesis actually. We'll ask about any immunosuppression condition because fungal reactivation of tuberculosis occur in immunosuppressive condition, whether the immunosuppression is because of drugs or any chronic immunosuppressive viral illness like HIV. In the family history, we'll ask about lung cancer, which runs in families, tuberculosis, hereditary hemorrhagic telangiectasia, which has autosomal dominance inheritance. It can also present as hemoptysis and epistaxis. Then we'll ask about bleeding disorder or thrombophilia in the family, which will help us guide towards the cause of hemoptysis. Then we'll ask about any drug history, including antiplatelet and anticoagulant use, OCP use, which can cause pulmonary embolism, DVTs, stuff like that. We'll ask about the cocaine abuse, which can cause pulmonary hemorrhage and infarction. I hope you will like the video and please subscribe to the channel, and thank you.